epidemiological studies and non-epidemiological studies. And non-epidemiological studies include case study or case series, in other words, or opinion from a specialist based on biological and clinical practice principles. And these study is actually, we don't consider epidemiological studies because they don't have a control group. So someone might talk about what happened to particular patients, but that's with the very detailed data. But they are not trying to compare the case versus control. So there's really not a control group in this study. And epidemiological studies have control groups. And within the epidemiological studies, and we can divide into experimental study and observational studies. And experimental studies have mainly two classifications. One, randomized controlled trial. Sometimes we call this RCT, and non-randomized trial. So experimental studies, and we often allocate patients to certain treatment, okay? And you take this drug and you don't take this drug. And researchers decide and who is going to take a drug, okay? So when you decide, researchers decide who is taking a drug, and if that decision is made randomly, like you flipping coin, and if you get the tail, you put the patient into a control group. If you have a head, and you allocate patients to an intervention group, and that we call the randomization. So if the researcher did the randomization to allocate patient to a study drug, and we call those a randomized controlled trial, okay? And then some studies don't randomize patients to treatment. They might just decide, okay, in patients in this clinic, and take this drug, and patients in the other clinic and don't take drug. Okay? And no randomization is involved, and we call those non-randomized trials. And in contrast to experimental studies, and we have observational study. So in observational studies, and there are mainly three study designs: cohort studies and case control studies. And cross-sectional studies. And difference between observational to experimental, and in observational studies, researchers do not really decide and who to take a study drug, and they simply observe. So the patients come to clinic, and then physician prescribes certain drug to patients, and researchers do not really participate in decision-making process. Instead, and the researcher just observe what happened for these patients, and then collect the data from this real-life setting. Okay, so those are observational studies. So this is a very, very rough guideline, but the important evidence and people sometimes use is as follows. So non-epidemiological studies get the least ranked least in importance as evidence. Okay, and then we think randomized controlled trials is the most important as evidence, and then observational studies can come next. Okay. Within observational studies, probably cohort study is better than case control study, and case control study is better than cross-sectional studies. And then so there is a hierarchy and indicate importance as evidence. But be careful. As I said, this is just a rough guideline. So now in this lecture, I'm going to show you what is each type of study design and what are pros and cons. And after you understand that concept, and I want you to read a clinical paper and decide on your own. Okay, so this is just a brief guideline. In the next several slides, and then we are going to learn what is a randomized clinical trials, and what is a cohort studies, and case control study, and cross-sectional studies. Okay, so as I say in the previous slide, and difference between experimental versus observational study, and who will receive a study exposure in new drugs or the study of interest is determined by a researcher. Okay, and experimental study, if it's yes and you're doing experimental study, and if it's no, you're doing observational study. And in the experimental study, and if the intervention treatment allocation is done randomly, and you're doing randomized clinical trials, and if it's not, you're doing non-randomized clinical trials. And I just realized it. And in the previous slide, and I say randomized controls trials, and so